Hello friends, I am Dr. Smruti Karambelkar and I am a psychiatrist, and today we are going to do some strong myth busting around mental health, medications and psychiatrists. Let's go. Oh, I wish that I could read minds. That would make my job so much easier and I didn't have to study for 3 years to understand. Alright, but of course not. No psychiatrist, or for that matter, no human can read another human being's mind. What we do as psychiatrists is try and understand you as a person from a biological and from a medical and from a psychological point of view to try and see what's going on. So this is a very common myth. As doctors, yes, one of our most important, if not the most important part, is to try and treat any illness with medications as a part of it. But of course, we do not only prescribe medications, as mental health issues are very complex and can be caused by many factors, like there's some issue between husband and wife causing stress in their marital life. Here, things like couples counseling is very important. Maybe stress is going on just before exam, and hence counseling for that student on how to tackle that stress. Some relaxation exercises are different techniques that also a psychiatrist helps you in learning in how to manage whatever mental health issue you've come there with. Now this is a complex myth. Okay, so I would say that mental health issues and the current treatments that are available for it resemble the treatments that are available for diabetes and hypertension. In the same way that once you do get diabetes, you have to continue those medicines for a long time, even lifetime. In that same way, a lot of mental health issues are chronic, they are lifelong. And the medications that are currently available do not cure it from root, but in some ways try and control those illnesses. Hence, they may have to be taken for a long time. But the warning here is that not all mental health issues continue for a lifetime. Some mental health conditions are very time limited or situation limited, or well, we are lucky enough and they do get cured with the medications available. So no, it depends on what illness we are getting treated for, and hence not all psychiatric medications will have to be continued for lifetime. That's a really funny myth, I find. Do you only go to an orthopedic if your leg is broken? Do you only go to a physician if you are having a heart attack? No, right? In the same way that all illnesses have a meter from mild to severe, to some things just being a stress. Alright, and as psychiatrists, as doctors of the mind, we can help you with any issue that is related to your mind. Not forget whether it is called a mental illness or not. Hence, we would in fact encourage you to seek help not just from a psychiatrist but from any mental health professional for any issue related to your mind, related to stress, so that you don't go digging a well when there's fire in your house, so that you learn better skills at coping. Do only weak people suffer from tummy problems? Do only weak people break their bones? No, definitely not. It is a very big myth that mental health, mental illness is equalized with weakness. Any person who has a brain, their brain can undergo chemical changes which can lead to any mental health issue. Hence, it is a myth that only people with weaknesses suffer from mental health issue. We have different mental health issues in different age groups. In the same way that somebody may get their first episode of depression in old age too, and they may feel that I have now become weak because of old age, but that's not true. So in that same way, any person, irrespective of their age, their gender, their occupation, their socio-economic status, any one of us can suffer from a mental health issue.